So my name is Krystal Archer-Arroyo. I'm an associate professor in emergency and trauma imaging at Emory University in Atlanta, Georgia.
Okay, great. Please, what do you consider to be the main challenges facing radiology in Latin America today, both from a clinical and a technological perspective?
Okay. I think Chile experiences a lot of challenges that we experience in the United States as well, clinically in terms of staffing shortages, which includes, we have some attrition from people retiring, and we're trying to, train as many trainees as possible, as well as patient access to technology. As you can imagine, CT scanners, ultrasounds, MRIs are very expensive. So in the larger cities in the US, that may not be an issue, but we still have issues with patients who are in rural settings affording that type of current technology to make the diagnosis for the acute pathology.
In the context of rapidly advancing artificial intelligence and other technologies, how do you think radiologists can adapt and remain relevant in patient care?
Okay. In terms of AI, radiologists adapting to using the current tools. I think that's very helpful in terms of facilitating us reading better, reading more accurate. A lot of the tools we have available currently help us prioritize studies. On our list in emergency radiology, everything is stat. So how do we know which one is acute or not? There's some tools out there that can help prioritize those things. And I want to reassure people that AI will not replace radiology. That's sometimes one of the barriers to people learning the new technologies. I don't want to learn it because it will replace me. And that is not true. I tell people medicine is an art, not a science. If it was science, a monkey could do it, which means that AI would have to be 100% correct a lot of the times. And you will see when you practice, there are nuances. I recently had a case where it looked like subarachnoid hemorrhage. It wasn't very bright. AI did not call the subarachnoid hemorrhage. I called the clinician and I said, "This looks like subarachnoid hemorrhage. Is the patient anemic? Is that why it doesn't look so dense? The blood looks so dense." And she goes, "Yes, the patient's hemoglobin is 8." So there are things that, in terms of our expertise, that again, AI can't replace, but AI can help augment us in terms of helping us finding pathology faster so the patient can get treated faster.
What role do you believe international organizations such as RSNA should play in supporting radiologists and healthcare professionals in the region to overcome these challenges?
So I think the Spotlight course is a great example of the role that RSNA plays. Again, I think lots of organizations play different roles, but in terms of education, RSNA, that's really its wheelhouse. So in terms of overcoming training the trainees, keeping radiologists up to date to, current technology and how to use it, I think these Spotlight courses are very key in terms of education. And then there are other organizations out there who can help in terms of setting up equipment and those sorts of things in more rural or under-resourced areas.
And the last one, from your experience, what strategies or approaches would you recommend to manage the growing demand for radiology services in the face of resource shortage in some countries of the region?
Yeah. So I think some strategies, there's a couple that come to my mind, is we're pretty much in the sandwich generation. We have the baby boomers who are now looking to retire, and we now have the newer generation that we're trying to recruit, to maintain our current staffing needs. So I think we have to dig deep in both pockets. Yes, we have to convince our older colleagues to not necessarily retire full time, but maybe work part time to help us, maintain our staffing needs. And the younger ones, if we identify people who are very advanced in their knowledge, well, let's set them up a little bit more so again they can be currently working. Um, other things that we can do in terms of helping each other out, especially under resourced areas, it requires some, infrastructure, but teleradiology can still be very helpful. Maybe there's one person covering a remote area. Well, if this teleradiology, again, they can use people at a tertiary care center as either we can help them with the volume or help them with more complex cases, again, helping those patients who may be in more suburban or rural areas who don't have access to, again, maintain that level of patient care.
Okay, great. Thank you very much.
Thank you.